Hey everyone! Today we'll explore the intersection of social welfare and immigration policies, particularly how immigration impacts both the U.S. social welfare system and the services available to immigrant communities. Social welfare policies play a crucial role in ensuring that people in need have access to services like healthcare, housing, and food. However, immigration policies often shape who can access these services. The Social Security Act of 1935 was a major milestone in the institutionalization of social welfare programs. It marked the beginning of a federal government commitment to provide financial assistance and support for those in need. This law laid the foundation for many welfare programs we still use today, like Social Security, unemployment insurance, and disability benefits. It changed how we view the role of government in helping people during times of financial need. While this law didn't immediately provide benefits for all Americans, as immigrants were often excluded, it set the stage for later discussions about expanding social services to broader populations, including immigrants. It was enacted during the Great Depression as part of President Franklin D. Roosevelt's New Deal, and it marked the first large scale federal intervention in social welfare in the United States. Some key provisions included the Old Age Assistance (OAA), the Unemployed Insurance (UI), and Aid to Dependent Children (ADC). It institutionalized the role of federal government in addressing poverty and economic insecurity and shifted social welfare from private charity models to structured government-backed systems. It also inspired future social programs such as Medicare and Medicaid. Social Security remains one of the most influential and enduring welfare programs in the U.S. The civil rights movement of the 1960s was pivotal in pushing for justice and equality. One of the movement's key achievements was the expansion of social welfare programs to include marginalized populations. The civil rights movement didn't just fight for racial equality, it also made sure that the most vulnerable in society, including immigrants, would have access to vital social services like healthcare and education. Policies like Medicaid and Head Start were created as a part of this push. These programs sought to reduce disparities in health and education for African Americans, Latinos, and other communities. Medicaid was created as part of the Social Security Amendments of 1965, and it aimed to provide health care coverage to low-income individuals, including people of color who had limited access to medical services. And Health Head Start is a comprehensive early childhood education program launched in 1965 to assist low-income children, many of whom were African American and other minority communities. Now, let's take a closer look at child welfare systems, which play a critical role in supporting children from low income or at risk families. The welfare of children, especially those in immigrant families, is directly influenced by policies in families, schools, and government programs. These systems work together to provide a safety net for children who are facing challenges such as poverty, abuse, or neglect. Within families, the family is recognized as the first and most critical environment for a child's development. In cases of neglect or abuse, intervention may be necessary, and Child Protective Services (CPS) will step in to ensure the child's safety. When a child cannot stay with their parents, they are often placed with relatives, ensuring stability in family connections. Within schools play a crucial role in identifying potential signs of abuse or neglect. Teachers and school officials are required by law to report any suspicion of child abuse or neglect to child welfare authorities. Schools serve as a protective space for children, providing meals, social connections, and sometimes counseling, which can ease some challenges they may face at home. And within the government structures, CPS is a key part of the child welfare system. They are responsible for investigating reports of abuse and neglect and removing children from unsafe environments when necessary. And courts make determinations about the child's safety, placement, and long-term care. And they often rely on the recommendations of CPS and other agencies. And the Adoption and Safe Families Act, ASFA, and the Child Welfare System Improvement Act are federal government's programs that set standards for care, foster placement, and adoption services. Now we'll dive into some key immigration policies that have shaped the welfare system in the U.S. These policies have had a profound impact on who is eligible for social services and how immigrant communities interact with the system. Policies like DACA, and the Affordable Care Act further influenced access to services, allowing certain groups of immigrants to access health care, education, and other services, though many still face barriers. First, let's discuss DACA, an executive action by the Obama administration that provided temporary relief from deportation to undocumented immigrants who came to the U.S. as children, also known as Dreamers. This allowed them to apply for work permits and access some public benefits. DACA recipients were allowed to work legally, which increased their ability to access healthcare, education, and social services. The Affordable Care Act, ACA, of 2010. The ACA expanded access to healthcare by establishing health insurance marketplaces and providing subsidies for low income families. Legal immigrants and certain visa holders gained access to healthcare insurance through state exchanges or Medicaid, while undocumented immigrants were unable to access Medicaid or ACA marketplace plans, though they can receive emergency medical services in some cases. The Immigration Reform and Control Act of 1986, IRCA, stands as one of the most significant turning points in the relationship between immigration and social welfare. IRCA granted amnesty to nearly 3 million undocumented immigrants and legalized their status, which made them eligible for public benefits and certain social services for the first time. However, it was also imposed penalties on employers hiring undocumented workers and increased border enforcement. While it allowed immigrants to contribute more fully to society, it also created tension between welfare access and the labor market, as some industries became more reliant on immigrant labor without offering corresponding benefits. And in closing, today's discussion has shown how welfare policies are deeply connected to historical movement, governments, structures, and lives of individuals. As we reflect on these issues, let's remember that social welfare is not just about policies, it's about people. It's about ensuring that families have the resources they need, that vulnerable populations are protected, and that justice and equity remain at the heart of our systems. Thank you all for your time and engagement today. I hope this presentation has sparked new insights and meaningful discussions. Otherwise, thank you again and have a great day. Bye.